Hello there and good morning and welcome to Thomas-Emrus University Health Board's latest Facebook Live. This morning we're in the beautiful setting of Ysbyty Cwmcarn in Mountain Ash. My name's Gareth Setter and I'm part of the Communications and Engagement team here at the Health Board. I'm going to introduce you to our guest in a second. We're going to be talking today about the WISE programme, the Wellness Improvement Service, which is one of the Health Board's latest, newest and innovative services available to you as our patients. So we're going to be finding out what it is, how you get involved as a patient, how it can help you and so on. And also we'd encourage you can get involved as well because this is a Q&A session here on Facebook Live. So please feel free to ask any questions about the WISE programme as we go along, or make a comment about the WISE programme as we go along. All you do to do that is just as you're watching this video, just put your question in the comment section as you would on a normal friend's Facebook post. So please feel free. If we can't get to your questions during this session, then I promise you that we'll make sure that they're answered after. And this video will also be posted to our Facebook page after we've finished. So that's all the housekeeping bit done. Let's get to the important person in all of this. And please introduce to you Dr. Liza Thomas-Emrus, who is the clinical lead for the WISE programme. We say clinical lead, basically that means she's the boss doctor. She's in charge of it all, and she knows all there is to know about WISE. Morning, Lisa. Welcome. Thanks for doing this. We really appreciate it.
I'll definitely let my team know that that's the name you've given me, and I'll see how it lands with the rest of the team. See if it sticks.
So let's get into it then. If someone's watching this and they've got absolutely no idea what WISE is, tell us all about it.
Okay, so it's called the Wellness Improvement Service, like you said, or WISE as we know it for short. And it's a service that serves the whole of the Cwmtawd-Morgannwg area, so patients from across our whole health board catchment area. And we can look after patients who are in the primary and community care, as well as people who are on secondary care waiting lists. So we're trying to make it as inclusive as possible for everyone. At the moment, it's just for 18s and over, so adults, although watch this space because we're trying to extend that. And the point of the service really is to help people to feel better despite what health problems they might have. So we know that if you've got a long-term health problem or long-term symptoms, that can affect every area of your life, and patients often feel like they're completely defined by their health problems. So we want to try and address that and change that, because obviously with the COVID pandemic, that's put so much extra pressure on the health service that things like waiting lists have gotten even longer. Accessing your GP can be even longer because there's so much more demand on the system compared to the availability of the service. So we don't want that to increase people's risk of getting worse while they're trying to access health specialists. So that's the main ethos of the service, to empower patients and give a sense of control to people about what they can do to improve their own health while waiting, or maybe instead of needing a specialist health intervention. So my background as a doctor is in something called lifestyle medicine. Right. So that's a field where we use evidence-based lifestyle changes. So we prescribe a lifestyle change that we know has got really good evidence for helping improve your problem. So if you came to me, for example, and you knew that you were, or had recently found out that you were starting to develop type 2 diabetes, or just been told you have type 2 diabetes, then lifestyle medics like me can help you reverse that and get rid of that disease without needing to go on medications, and make sure that the rest of your life is not going to be affected by type 2 diabetes. Okay. So that's a narrow example, but it can literally fit everywhere.
Yeah, it's great to have those sort of examples. And when we say like long-term conditions, so obviously type 2 diabetes, what other sort of things that people will know?
Literally anything you can think of, lifestyle medicine can fit into that. So main examples in our service at the moment is people with chronic pain. So chronic pain is if you've had a pain for longer than 3 months, And that can be any type of pain. That can be pain in one specific joint, like knee pain, or it can be whole body pain, which lots of people do suffer from. So we can give you and coach you into better ways of managing that pain without needing to revert to pain medications. Now, it doesn't mean it has to be instead of pain medications. So the service doesn't say, right, let's get rid of all of your medications. It's more about giving you added tools so that you have a toolbox full of stuff that can make a difference to that pain, for example. And then you might find over time you don't need as many tablets, so you don't suffer from the side effects of the tablets.
Okay.
But the service is to help people with any chronic, so any long-term symptom, any long-term disease, or if you're on a waiting list. And we look at the main areas of lifestyle medicine, which you can see behind me here. So having social connections, that means like who you are as a person in your community, in your family, having a sense of purpose, having a social life, having a family network, having that support around you, that's really important. Or things like work, you know, you don't want your health affecting your work. So we look at areas like that. Mental health, obviously, if you've got a physical health problem, it's going to affect your mental health. If you've got a mental health problem, it's going to affect your physical health. So we need to address you as a whole person, mind and body. Exercise, obviously, we all know that moving more is good for us. But if you've got, for example, long-term pain, exercise might be something that's really difficult for you to do, or you might feel worried about exercising and whether or not that's going to make your condition worse. So we can address that and make sure that you can fit it into your life around your health challenges. Healthy eating, obviously we all know that we need to be eating more vegetables, more fruit, more colourful, real-world food. But again, that can be easier said than done. You know, we all know the theory, but doing it in practice, especially in some of our poorer communities where it's difficult to access good food, we can help address that. Yeah. Sleep. So sleep is one of the most important things. We all have to sleep. Sleep helps us repair our bodies. But again, if you've got a health problem, that might be making sleep really difficult, or you might be in too much pain to sleep. So we can work on action steps to put sleep right and help sleep make things better. And then obviously if people have got problems with alcohol, smoking, or illicit drug use, then we can support you to find a relevant service to address those things. So in order to get good mind and body health, we have to balance all of this stuff. And that can work. These are the main things that we should all be focusing on, and our specialist interventions then are on top of this, with this as our foundation, if that makes sense.
So taking the example of chronic pain, if I came to you, so what practically then, just to help people understand, from like a physical exercise point of view, I know it's hard because it's an example, but what would you be saying to me, or would you need to exercise in this way, or do you know what I mean?
Yeah. So, like taking it right back to basics, if you're someone who sat at home, you've got chronic pain, or you know you might be on the waiting list to see a chronic pain specialist, and you might not know when that is, so you're really suffering day to day and you're not really sure where to get support, then the first step I would do is go onto the CTM-WISE website, so Google it, CTM-WISE, or it's ctmuhb.nhs.wales/wise-CTM. We'll put the link in the chat, I presume. Go on there and self-refer, so there's a little button on there that says self-refer. Then our team will get that, and you can write in there that you're suffering with chronic pain. And then one of our coaches will call you in for a one-to-one, and we'll review what matters to that person, and look at how that pain is actually affecting every area of their life, including their exercise, and work out what kind of goals they have. You know, importantly, what kind of exercise did they ever do? What do they want to get back to? And maybe you've never done exercise before, so you're not really sure where to try. So we might need to get some local support of an exercise specialist to help with that. But with WISE, we've basically got a coach that you can have for up to 9 months, as well as support from me and another medic, where we can really target what can work for you for introducing exercise into your life. So it might be the support of the National Exercise Referral Scheme, or it might be that we give you action steps just to start introducing that at home or in your community.
So it's really tailored to you as an individual
Yeah.
when you come for that initial consultation.
Yeah, so the first appointment with a coach is one-to-one, and that's where we really look at exactly what matters to you and do some baseline measurements, just so we can really see where you're at and where you need to go. So we look at you as a whole person, so the service is really holistic in that way. And then we see patients then in group settings, because the evidence shows that being seen in a group actually gives patients more satisfaction and more information than being seen one-to-one. Because if you imagine, I'm seeing a patient for 10 minutes, for example, in practice. Well, as much as I want to give you all the information, 10 minutes is 10 minutes, you know, whether you like it or I like it, neither of us like it really. So you can only get limited information. But if I've got patients in a group for an hour and a half, that's an hour and a half of information that you get. And individually, you can have a few minutes each. But the whole group gets to ask a question. So you get everyone's answers, which invariably are the questions that you've had all along anyway.
Yeah.
And you learn from other people's experiences. So, you know, Mrs. Jones here might have had chronic pain and not being able to exercise, but she's now 4 months of working with her coach and is now exercising, and her independence is much better, and she's really enjoying moving more. But she can tell you, I was in that situation and this is what worked for me.
Yeah.
And that's always going to be more powerful.
I was going to say, it must be really powerful, because you must be sat there as well thinking, gosh, that's exactly what I'm going through, and that's what I'm feeling. Now, if you're just joining us, this is Facebook Live. We're doing a series of these here at the Health Board. Today we're talking about the WISE programme, the Wellness Improvement Service, and I'm with Dr. Liza Thomas-Emrus here. Lisa, you mentioned about self-referral, so you can self-refer into the programme, but I'm guessing your GP might refer or mention it to you.
Yeah, so anyone can refer. So yes, you can self-refer if you're at home and you feel like you've got a long-term symptom or a long-term disease, or you're on a waiting list. Or your GP or your healthcare assistant, your practice nurse, your pharmacist, your physio, your mental health worker, any health professional can refer into us. And the secondary care consultants can refer to us as well. So when they see patients and outpatients, or they know they've got these patients on their waiting list, they send us those as well, because the consultants want their patients to have a coach as well, to coach them to better health. Because if you've got like a surgery, for example, or you're needing a specialist injection or specialist treatment, then adding all these elements in makes that specialist intervention more powerful, and you're less likely to get bad outcomes. So that's the key, is marrying the two
together.
Yeah.
So with waiting lists, we know, as a health board, a priority is to address our waiting list. So if I'm on a waiting list, I don't have to have, it's not necessarily the condition that I'm on the waiting list for that WISE can help me with, can it? Can help me with anything?
Anything, yeah. Because if you think of, what we want to do with WISE is see people as a whole person. So very rarely do I see a patient and they've just got diabetes or they've just got knee pain. Those are the lucky people often, because most people will have this knee pain, but actually it's restricted them so much. They've now developed mental health problems and they're getting more anxious, or their mood is lower. And because of that, they're having digestive problems because their stress levels are higher. So the service looks at you as a whole person. So it doesn't matter what your disease or condition is. It's more important for us to look at how is it affecting your life, and how do you want your life to be, and how can we get there? Because we don't want you to be consumed by a health problem. We want to look forward, and where can we get you? What's the best condition we can get you, so that these are just part of your history, medical history, as opposed to who you are as a person.
Yeah. And I suppose to reassure people as well, while you're on that waiting list, if you were to join WISE as a patient, it doesn't take away from that waiting list, does it? It just
so it doesn't disadvantage you. So we don't want people to think this is an alternative, and feel like they've just been bumped to somewhere else to deal with a waiting list problem. This is more about how do we get people to stay as well as they can, or get better, through looking at the real world evidence that's out there that shows that this stuff works. And it might be simple or common sense to lots of people, but it's not easy in practice. Otherwise we'd all be healthy. That's the thing, is a lot of the theory you might know or be aware of, but putting it into practice in our communities does have a lot of hurdles to it. So that's why we feel having a coach, so WISE has got coaches, wellness coaches, so having that coach can really hold your hand to get you where you want to be and address what really matters to you.
Perfect. And don't forget, if you've got any questions or comments at all, just pop them below below the video, as you would normally on Facebook. Lisa, as well, Come Taff Maganag, we cover a large area, so I'm guessing it doesn't matter where you live within the health board. So how does that work?
So when you refer, or your carer or relative or specialist refers, our team call you and find out where you live, where your postcode is, and all of our clinics and group coaching is done in areas as close to your postcode as possible. So we try and make it as convenient as possible, where there's easy access, where there's not where it's on the transport links. So it's often community venues, so Merthyr Bulls Club for example, or in rugby clubs or community halls. So as close to home as possible. And then the patients are seen one-to-one, as I said, first off, and then in a group. So you're with like-minded people, and you benefit from the experience of other people, and you develop that peer support essentially. And that is run by the coaches. So we've got 7 coaches in the service, and often there's a volunteer as well to provide extra support. You're given paper resources and digital resources as a kind of a guidebook to help you stay on track with what your goals are. And then each session then is designed to look at a particular area of your health needs essentially. And you can have the coaching for up to 9 months. So you don't necessarily have to stay for 9 months, but up to 9 months. So it's quite intensive support for quite a long time. So we can really help implement long-term changes. And then we also have things like self-management apps that have been approved by UCL in London that have shown that they make a big difference to patients' health and well-being. So for example, if someone really suffers from sleep problem, and we know that sleeping tablets don't work long term and they're not a good solution in the long term, well there is a certain app that we can prescribe to patients that has been shown to make a big impact with improving people's sleep. So things like that, and we try and partner with lots of community projects that are already working really well in people's communities, because that's the thing when we're talking about wellness and well-being, it's all about bringing that back to the community and working out what works in that community already, and spotlighting that and highlighting that and supporting that organisation. So Get Fit Wales is an example. So our patients can have Fitbits with the Get Fit Wales coaches, and as they meet their step goals, for example, they will get vouchers to spend in local small businesses, so in the butchers, for example, or in the fruit and veg shop in Abercynon. So that helps you then address your physical exercise, but also you get money to spend on real food. So it helps close that loop essentially. Yeah.
I know it's relatively. So when did we actually launch WISE? It's still relatively new.
It's still relatively new. So we're only a few months in at the moment.
Well, there's patients on it already.
Yeah, there's patients with us already. Yeah.
What are they telling you? How's it going?
So the feedback has been fantastic. As you can imagine. So those patients that are really engaged in it, the more you throw yourself into this, the more you're going to get out, isn't it? Yeah. So the coaches are getting fantastic feedback where, one of our ladies, her pain was so strong that she couldn't go upstairs, for example. So she couldn't stay in bed with her, sleep in the same bed as her husband. She had to stay on the chair downstairs. She couldn't drive. She couldn't go into her daughter's house to look after her granddaughter. So her chronic pain had really restricted her life as a whole. But after a few weeks working with a coach and coming to one of my group clinics, she's now back driving. She's now able to go upstairs. She's going to the gym, and she's never been to the gym before. So that's helped her lose weight, and her pain medicine requirement has gone down. but most importantly, her sense of hope and identity is regained. I think that's the thing to focus on. Is yes, the symptoms are better, but she feels more like herself again, and that's what we should be doing as with medicine really.
Because would she say beforehand that it probably that had through no fault of her own controlled her life, and now she's turned that round?
Yeah, so now she feels more in control. Yeah. So that chronic pain is no longer the main focus and the decision maker essentially. Now she can actually do what she wants to do.
Yeah, amazing.
Yeah.
Thank you, Lisa. That's absolutely brilliant. We really appreciate it. What we'll do is we'll make sure that you've got all the details that you need if you want to self-refer. But it's all on our website, so you can just, if you pop Contact Mechanic into Google, but we'll make sure it's on the video, the details as well, so that you can self-refer or find out more about the WISE programme. Thanks again, Lisa. We really, really appreciate it.
No problem.
Thank you to you for watching, and we'll see you soon. Thank you very much.